Oh, hello, Doc.
Hello, Doc.
Hello, Doc.
Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
Good afternoon, Doc.
Good afternoon.
How are you doing today?
I'm very well by God's grace.
You're welcome. It's always a joy to see you. So today we are going to be looking at something interesting, but a lot of people don't pay attention to. We're going to be looking at occupational accidents and diseases. You know, every occupation and the hazards that it comes with. While we are looking for money, sometimes unfortunate incidents do occur. So that's why today we need to have this discussion so people can be much aware and then they know how to take care of themselves. So let's get straight into the conversation. We want to know, what are the most common occupational accidents and diseases that we have?
Okay, so let me talk more about the diseases.
Okay.
Yeah, that's what is more my field. So the commonest diseases we have skin conditions are one of the commonest, usually from contact dermatitis. So when they touch things that irritate their skin. Yeah. Another common one is the respiratory conditions like asthma and what we call chronic obstructive pulmonary disease. It's a group of diseases usually called COPD for short.
Okay.
Yeah, so you might think that asthma isn't something you are born with.
Yeah, but I know it can
yes,
develop
you can
along the
develop
way
it,
sometimes.
Yes, you can develop it sometimes. So especially if you have it in your family line, you might not be born with it, but you develop it if you are working, especially with a place where there's a lot of dust, wood dust, chemical fumes, solvents, pests, like
those who work in the industries,
yes,
where they use a lot of
even
chemicals.
with pests, if you have a lot of pests, they produce their should I say their excretions, their feces and all those things they also produce those should I say some small microfumes, if I should put it that way.
Okay.
Yeah, and mold as well, vehicle exhausts, and then any kind of air pollution that might be within the field where you are working, it can lead to these chronic respiratory conditions.
Okay, so can you give us a couple of examples of the chronic respiratory conditions you're talking about?
No, that's the asthma and the COPD.
Okay, so the COPD is just one disease?
No.
So can you give us some examples of that one, or should I say types? I don't know how.
The easiest one for people to remember is the COPD.
Okay.
Because if we talk about emphysema and all those things,
we are going too far.
Too technical. Yes.
Okay. So we want to know, how can we identify certain potential?
We are not done with the
types. Sorry.
Yes. So we have the musculoskeletal disorders.
Okay.
Okay, that's usually from in the office settings, where probably the posture, the chairs that they are using, the table, the chair and table, the distance is not very good. And then also we have what we call repetitive strain injuries. So when you do a particular should I say maneuver with your hands or some parts of your body repeatedly over a long period, especially those who type a lot. We have what we call carpal tunnel syndrome, which is quite common nowadays. So people have this severe pain inside their wrist, and they can't do anything with their hand and all. It's because of these things. So repetitively, especially cashiers and those kind of people who press a lot of hard things. Yeah. So that is also one of the commonest things. But a lot of other things, the spinal issues people have because of the sitting position, the kind of chairs that they sit on.
The back pains and all that.
Yes.
Okay.
Then another one is lead poisoning. Lead poisoning too, especially with people who work in manufacturing with metals, shipping industry, sometimes those who do like decorative painting of I don't know whether it's decorative things in the house.
Okay. So like the carpenters who paint the
not necessarily even pottery, painting pottery and all those things. Some of the things they use have lead in them, and even plumbers. Sometimes we have these lead-based plumbing systems from the olden days, which people still have
in their homes.
Yes. So once you are inhaling the fumes around it, usually they break down a little bit into the atmosphere. So once you keep inhaling, it can cause infertility, it can cause kidney disease, it can cause even some brain issues. And usually lead poisoning, you can't really see the symptoms until maybe years after a long time of exposure. Then you start having the weight loss, memory loss, abdominal pain,
and by then it would be too late.
Not necessarily too late, but if we do further investigation, we'll find out that it's because of your working experience. Then there's hearing loss. Those who work in the manufacturing, mining companies, they don't protect their ears well. There's also the stress, mental health disorders, especially those in the high pressure situations, the military, sometimes even the emergency services, fire service, sometimes emergency medicine like the ambulance, EMT, those who work in the emergency room and all that. Sometimes the things they see and they experience, it can lead to PTSD and those kind of things. Infectious diseases, of course, in the hospital setting, or if you are working in a lab setting and all that, yes. And then the newest on the scene is what we call computer vision syndrome. So you sit at your desk all day looking into the computer for a long period of time. It causes this eye condition. You have blurred vision, strain in the eye,
headaches and all that.
Why you've been experiencing it?
No, I mean, as apart from the fact that I wear glasses, usually when I take off my glasses and then I use my laptop for a longer time, I experience those.
And even dry eyes, itchy eyes and all those things. So from prolonged, so those are the commonest ones we see.
Okay, so we want to look at identifying potential health risks in our workplace. You've given us so many examples of these diseases and then how they are come about and all that. But how would I be able to know that, okay, I work in this particular place and these are the sorts of health risks that can be involved in my work?
Yeah, so basically we have different kind of agents. If they're biological agents, especially in the healthcare facilities, bacteria, viruses, if you're working with animal farming and those kind of things. Yeah, then there's the chemical agents, depending on the company where you are working, what they are manufacturing, the lead, the mechanics working with car batteries and all. You see there's a lot of lead in the car batteries.
And then acid as well.
Yes, so when you are working with those kind of chemicals, the mining, those who use the mercury and all those things, the chemical agent. Then there's ergonomic issues. That's about the way you sit and position your body. So then there's also the physical agents, high temperatures, extreme noise, extreme vibrations. The construction workers that work with those things,
those drills.
They can get a lot of accidents and diseases from those ones as well. Then psychosocial issues are also important. So your workload, stress, if there's bullying or harassment in the workplace, and even violence against you, especially the police, military people, the violence and all those things, they can also be a cause, even not only physical but psychological stress. And
it takes a toll on you.
Yes.
Okay, so we want to see, now we've identified these health risks. How are we able to prevent some of these diseases, or how can we make sure that even though I'm working in this industry, I've been working here for 5, 10, 15 years, how do I protect myself from some of these diseases?
Okay, so basically you have to be able to identify the risk factors based on where you work and then the items you are working with, and then try to avoid exposure to those risk factors. So if you have to change your furniture, your chairs, you have to get protective eyewear and all those things, you do that. But if maybe you are in a case where the exposure cannot be helped, you have to be exposed, then you have to limit the amount of time you are exposed to.
The bosses won't understand that.
No, so if maybe you are working with chemicals and all those things, you have to limit the amount of time
you spend with.
If you are doing work maybe in a place where there's radiation and all those things, you have to limit the amount of time you are exposed to those specific
radiations.
Yes. So you limit the time, limit the dose of the exposure entering your body. You can do that also with the PPEs, the nose mask and all those things.
I was going to come to that.
And then you should be aware of how toxic the chemicals are, so that you know how to see if maybe you are reacting to something. And then you should know your body too. If maybe you are more susceptible to this condition than others.
Yeah.
So if you know your family, everybody's an asthmatic except for you, then you go and work in a
construction firm and all that. Yeah.
So you should know that you are putting yourself at risk. So you prevent it that way.
Since you mentioned the PPEs, that is the personal protective equipment, let's look at the various PPEs that are available for, various industries, and then also how often we are supposed to change these PPEs. Because for me, I know that nose masks are disposable. You wear it a day and then you discard it. But sometimes Ubehu said somebody's nose mask is very dirty, which tells you that the person has probably been using it for like a couple of days. So we want to look at the PPEs, the types, various types that are available, and then also how often that we are supposed to change these things that are protecting us.
Okay, yes. So the most common ones that we see, like the most common injuries that we and disease that we see, are usually the contact and then the respiratory. So we always encourage, if you have to wear gloves, especially if you are holding something of high temperature, or just to avoid getting into contact with chemicals and other things, you have to always wear the gloves. And depending on the type of glove, the type of material that was used to make it, some are very tough, some are silicone, they are very tough, some too are just rubber, and they are supposed to be disposable. So you should be able to read on the packaging if it is disposable or if you can reuse it. Most often they are disposable. So those who use, they know it's disposable, but they still yes,
they'll wash it and then find ways around it.
You don't do that. If you want to one that is washable, you can get the washable ones and then use them. But don't be washing the disposable ones, because then you are reducing.
And even the washable one, someone will use it like 1 year, 2 years. The person will still order one. It doesn't matter.
No, it depends on the manufacturer's recommendations.
Okay.
Yes, because they know what they use it to make their product and how long it can last.
Yeah.
Yes. So it's best to follow the manufacturer's guidelines. But the ear muffs, the hard hats, and all those things, those ones are, you can repeatedly use them over and over. So that one
till they are worn out, and then you'd have to replace them.
Yes. So based on the effectiveness, so if you see the effectiveness has gone down, then you have to replace it.
Okay. So now let's look at some effective ways of promoting workplace safety. As I know, the usage of the PPEs would be one of them, but then if there are any other ways that we can also help in promoting workplace safety.
Yes. So for me, an important thing is about your mindset in the first place. So you have to have the right mindset. You have to learn about the hazards in your workplace. So don't say I'm working in a radio station, so there's no hazard
over here.
There's hazards everywhere. So you have to now look into it and try and then understand. And thank God for Google nowadays.
Information is free.
Yes. So you can just enter the place you are working. What are the hazards in my workplace? And just enter it in Google. It will give you a list of whatever might cause a problem for you or might develop as an accident later on. Then you have to have systems and programs and procedures set aside in the workplace to guide the employees.
Okay.
So it's legally the employers are supposed to develop all these systems and procedures and practices. But another important thing is the employees have to follow
these guidelines,
because the employers have done it, then they'll say, oh, it's just for show. Yeah, so I saw some someone who was like, but there are signs above everything that wash your hands. Then I was like, oh, I thought it was just for legal reasons. Like, no, you have to wash your hands. That's why the signs are there.
Exactly.
So people tend to try and ignore all these practices and think that it's just for show, but it's not. It's important for your safety. And also the employers have to communicate the hazard. So if a new person comes in, you have to communicate that this is a hazardous thing that we are.
There should be that continued training and education.
Exactly.
Okay. So for now, let's look quickly at the proper procedures for handling hazardous materials or equipment. I know it might differ from, industry to industry, but there are certain basic rules or guidelines that you have to follow regardless of whatever industry that you work in.
Yes. So I don't want to speak to that because depending on the industry, they have their industry standards.
Okay.
Yes. So if you're in a manufacturing company, depending on what you are manufacturing, depending on the kind of chemicals you are working with,
the temperature and all those things.
Yes. So it's very, should I say, industry specific. Yes. So, but the common ones, the mechanics, the informal places that we are, a lot of times people just take a lot of things for granted. But it's very important to be wearing the nose masks, to be wearing gloves, especially when you're handling a lot of these metals and those kind of things. And especially plumbers as well.
And then the protective footwear too.
Yes.
Because sometimes they are working with sharp objects and all that, and then they are just in slippers going about it.
Exactly. So they have to take notes, and because it's informal and there's no legal employer kind of, they tend to take a lot of things for granted. But they have to be very careful to protect themselves from injury in the process of the work that they are doing.
Okay. And then finally, so assuming I go to work and then I get an injury, what is the first thing, or what are the first couple of steps that I need to take before, if maybe I visit a health facility or I go to a hospital or whatever it is?
Actually, what I was about to say is the first thing you should do is go to a hospital or a health facility. Don't waste time doing your own first aid, whatever. You can do, maybe if you are bleeding, you can try and then put some
Stop
pressure
the bleeding,
dressing, use a bandage and then apply some pressure, put a lot of cotton wool on it and then apply a lot of pressure to stop the bleeding. But that aside, anything else, please come straight to the hospital. Let them do a proper assessment of your condition. And in fact, if you want to do any other thing afterwards, they would want to fall back on your medical records before they go even forward. So if you don't have any medical record, they'll tell you don't have any evidence that you had a workplace injury. So the first thing you should do is get to a hospital, make sure everything is recorded on the medical system, whether they are writing it down or putting it on
the computer or
electronic
whatever
system. Yes, so that at least that will be your witness that you did have an injury or a disease caused by your workplace.
Okay. Thank you so much, Doc. As always, you give us some good education, and we'll see you next week. Thank you.
Thank you too.